Dang it, I have chlamydia. What do I do about it now? My partner was also positive for chlamydia, but I was negative. What do I do about that? These are the questions that we answered on My Health Spot. I'm very concerned that I have chlamydia. How do I diagnose chlamydia? The best way to diagnose chlamydia is going to be called a nucleic acid amplification test, which can be done both in men and women. It's a non-invasive test without a pelvic exam for women, and can actually be a self-collected vaginal swab in women, where if you ask your doctor, you can actually swab yourself. Or maybe if you get an extra stash, you can actually just swab at home and then take the sample to the lab. Vaginal swabs are more sensitive than urine samples and actually is the preferred way to take samples. Now for women, if you are getting a physical exam, the doctor may do an endocervical sampling, which is just fine. If you do have symptoms of conjunctivitis, you can also do a swab as well, and you can do testing on the eye secretions. Rectal swabs are a little bit different. The rectal swabs have to be done specifically at a lab that is CLI certified. It's a regulated lab. CLI means Clinical Laboratory Improved Amendments. Now, if the specific NAAT test known as nucleic acid amplification test is unavailable, then there are other types of testing which includes antigen detection and as well as genetic probes. Those are reasonable. The only problem is that they are invasive testing and they are less sensitive, but they are more rapid in the results, and also they are less expensive. So I'm concerned about having chlamydia. Should I be tested? Not everybody really needs to be tested if they're concerned about it. Specifically, those who do have symptoms that we talked about and they are sexually active, they should be tested with NAAT testing known as gen probes. Now, if you are sexually active but you don't have any symptoms and you're still concerned, should I still get tested? The answer is it just depends. So women that are less than 25 and those that are younger should get tested specifically, and all pregnant women, because the complications from chlamydia in women are a lot more serious. And so those women, despite being asymptomatic, really should be tested as well. Now, if you're concerned, you're sexually active and you have a new partner, or if you have multiple sexual partners, and also if you're asymptomatic and you are a man who has sex with men, then yes, you should also get tested. So anybody who engages in receptive anal intercourse should also get tested despite having no symptoms. The other thing that's very important, a key point, is that to test for gonorrhea also, because gonorrhea and chlamydia oftentimes coexist with each other and their symptoms can be very similar. So my sexual partner was diagnosed with chlamydia. Should I get tested? Well, yes, I think that you can go ahead and get tested, but the results of the test should not determine whether you should receive treatments. Because the infectious rate is so high, the recommendation is to go ahead and to receive treatment for chlamydia. Another reason to go ahead and receive treatment regardless of the results would include if you were a victim of sexual assault. I was tested positive for chlamydia. How should I be treated? So the treatment for that is actually pretty easy, considering that it's an antibiotic. Now, specifically if it's uncomplicated chlamydial infection, meaning that you don't have PID, you don't have spread to the pelvic organs, if you have uncomplicated chlamydial infection, then the treatment is going to include azithromycin. Now, you might have heard of azithromycin because it's also the same antibiotic used in Z-Pak, but the difference between Z-Pak is that it's a higher dose. 1 gram dose as a single dose. Now, a lot of times we'll take Z-Pak as 4 pills and take it at once, and that actually will clear it quite well. Now, if you're allergic to the Z-Pak, doxycycline at 100 milligrams twice a day for 7 days is also very effective and actually used for patients who are not pregnant. Now, because gonorrhea and chlamydia really do go together, oftentimes it's actually recommended to treat for gonorrhea oftentimes if there's a high local prevalence rate of greater than 5%, or if the partner was diagnosed with gonorrhea. In the situation with proctitis, with an infection of the anal canal, because the lab is has its flaws and has its problems, it's actually recommended to treat empirically. Testing can be done, but regardless of testing, we recommend to go ahead and treat, specifically in high-risk groups who are specifically men who have sex with men who practice insertive anal intercourse, and they'll have symptoms of a very pussy discharge. It's recommended to go ahead and treat. In that subgroup of people who have an infection, with proctitis, not only can they have chlamydia, but they can have gonorrhea as well. And it's actually recommended to treat for both. And the treatment of recommendation for that is going to be doxycycline for 1 to 3 weeks, depending on the severity of symptoms, along with an injection of antibiotic known as ceftriaxone at 250 milligrams of Rocephin. Now, if you have epididymitis, remember epididymitis is going to be the inflammation of the epididymis. Empiric therapy is recommended since treatment reduces symptoms rapidly. The treatment includes ceftriaxone or Rocephin at 250 milligrams of an injection one time, as well as doxycycline for 10 days. Fluoroquinolones known as ofloxacin or levofloxacin can be used for those who are allergic to the antibiotics that we just discussed. So I'm pregnant and I was diagnosed with chlamydia. Should I be concerned? Now, in pregnant women, because it's very important to prevent actual transmission to the baby as the baby's being born through the birth canal, it's recommended to screen every pregnant woman for chlamydia. The complication is that if the baby is born through the vaginal birth canal and gets infected with chlamydia, it gets to the eyes, and the eyes will actually develop an infection, resulting in a very severe pink eye, and oftentimes can result in blindness, and what is one of the most common causes of blindness throughout the world. So for that reason, every woman should be screened for chlamydia, irregardless of symptoms. The first line of treatment for those who are affected with chlamydia and pregnant will include azithromycin or amoxicillin. Now, because it's so important to make sure that the infection is gone, there is something called a test of cure, which is a repeat testing done after the treatment, but should not be done any earlier than 3 weeks after treatment. So I was tested for chlamydia and is treated. When can I start having sex again? Well, the important thing is that make sure that you're very compliant, you take your medication, and you want to specifically avoid sexual activity until 7 days after initiating treatment. And the sexual partner should also be treated as well at the same time. You can resume sex also if there are no symptoms at all in your partner or in yourself as well. Now, also another token to that is that it's very important to be tested for HIV as well as pregnancy. How often should I get retested for screening purposes? So once yearly testing for all sexually active women younger than 25 is very important, even if you don't display any symptoms and you feel just fine. Women, regardless of symptoms, who are pregnant should also be tested as well. Once you've been tested positive for an STD, it's actually recommended that you get screened every 3 months, because I'll just say you're more likely to get an STD again just because of bad habits. Should I get retested just to make sure the infection is gone? So what you're talking about is called test of cure, and it really depends on who you're talking about. So test of cure is to determine if current infection has resolved completely. It can be done 3 weeks after finishing therapy and no earlier than that, because you'll have false positives. It's specifically done for those who are pregnant and if there are any persistent symptoms or if non-compliance is an issue. Can be done if treated with antibiotic that's not as great as azithromycin. So azithromycin is the best treatment. If you're using amoxicillin or erythromycin, because those are inferior antibiotics, a test of cure can be done as well. So I was treated for chlamydia, but I still have symptoms. What should I do? Well, I'm going to tell you that usually is not due to treatment failure. The antibiotic, specifically azithromycin, is very good, but most of the time is because the partner was not treated and you got reinfected. The other possibility is that you might have had more than one type of STD at once. So not only is chlamydia can cause symptoms, but there are other things called ureaplasma, mycoplasma, genital herpes, and trichomoniasis, known as trich, can actually cause similar symptoms. Ureaplasma and mycoplasma are resistant to doxycycline and can show up if that was the antibiotic of choice. That's why my favorite antibiotic typically is going to be azithromycin. Now, herpes oftentimes will be pretty obvious. They'll actually be a painful sore, and those lesions or little sores can be checked by testing. And then trich can actually be testing by taking a swab of secretions and looking underneath a microscope. Some other things that can actually mimic a reinfection can be vaginal douching. Those are chemicals used that are very, very irritating and may mimic symptoms. Males who have chronic prostatitis, because prostatitis is so difficult to treat, that symptoms may appear to be persistent, but in fact they really need to have a longer course of antibiotics. So I was tested positive for chlamydia. What should my sexual partner do? So reinfection rate is very high, up to about 30% of women who have the same sexual partner. So it's ideal to have the partner tested, but a lot of times it's very impractical. So what doctors oftentimes will do will actually give an extra dose to call into the pharmacy that can be specifically for the partner. So this is known as expedited partner therapy, known as EPT. Now, EPT is not available for all states. It is legal in certain states. On the CDC website that I have provided in the description below, you can look that up and find out for yourself if your state allows for EPT. Now, again, after completing azithromycin, no sex for 7 days. You should treat any partners that you've had within the past 60 days or the last sexual partner that you've had sex with. So how can I prevent getting chlamydia? Well, one way is just avoiding sexual intercourse altogether. Now, for men, it's very important to use latex condoms every single time. If you are a woman under the age of 25, it's important to get tested yearly. Now, no sex if the partner has any symptoms including discharge, burning with urination, or a genital rash or sores. Well, that's all the time that we have for today. Next week, we will be talking about herpes. How do we diagnose it? What are the symptoms? If you want to subscribe, that'd be fantastic. Be sure to subscribe on the button below. Like it if you liked it, dislike it if you disliked it. Please leave some comments below, and we'd be sure to look at them. And if you want to support us, support a cause. So we are part of unboundnow.org, which is an organization that seeks to release women from sexual trafficking and just from all human trafficking in general. Go to the website, become more educated on the topic, find out where your local chapter is, and also give financially, and so that you can make a difference. So thanks for coming to My Health Spots. I'll see you next week.